This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Welcome back to Your Health, Your Wealth. I'm Chuck Taylor. Each and every Wednesday morning at 6:30 a.m., we get together and talk about all things relating to your health. And with us this time, I have a wonderful doctor who's going to tell you how you can brighten your smile, brighten your skin, all of the things that we kind of take for granted. She's going to tell us how we can enhance it and also do a little bit more to make sure that we can have it longevity-wise. Talk to us a little bit. Introduce yourself, Doc.
Hi, Chuck. Thanks for having us here. So I am Dr. Shalini, and I have recently joined Aesthetica at Total Health, and I am practicing facial aesthetics. About myself, I have been a practitioner since almost 20 years now, and in the latter half of my practice, I've been doing a lot of facial aesthetics. I primarily started my journey as a dentist, focusing more on the kids, that is a pediatric dentist. Mm-hmm. Then I also had a special interest in the cosmetic dentistry, which I was, practicing back then. And slowly and gradually, I moved into this cosmetics, or as you call the facial aesthetics part. Mm-hmm. So I've been doing it for almost 10 years now. I did a lot of courses in the US, especially Chicago and New York. Mm-hmm. And I've been doing a lot of up and down from India to US in the past many years. And then now, I'm here in Cayman, and I want to, enhance the beauty of all those loving and lovely, beautiful ladies out here.
So when we talk about facial aesthetics, it's so much that plays into that. You hear, you have the perfect bone structure. You have, people don't realize that over the course of time, these are some things that we can maintain, things that we can enhance, things that we work on. If I came to you and said, okay, Doc, I'd like a better smile.
Yes.
That's normally what people say.
Exactly.
I've been looking at myself all my life and I don't like the way I smile.
Yeah.
How can I talk with you and how can that be better for myself?
Okay, so Chuck, I would like to, stress upon a very good terminology here, which is a preventative facial aesthetics. So, we cannot be perfect. Mm-hmm. And let me tell you, you should not be striving for perfection. But you can always maintain the unique features which you already have. And by, it's facial aesthetics is kind of a term, intertwining term with self-care, self-confidence, mm-hmm. and a little facial aesthetics. Okay. So what you can do is you can start taking care of your face or your facial health or your skin early in your life, and these are proactive steps you can take to delay the aging process, to delay your appearance, your wrinkles, mm-hmm. your fine lines. See, eventually everybody has to age.
Right.
You can always age gracefully or delay the process of aging, and that is when you start taking care early. And it's applicable in terms of everything. Like for dental, you do a preventive dentistry. You always keep going to the visiting dentist. Mm-hmm. And even you go for regular screenings for your body. And similarly for your face, for your appearance, you should also take certain steps which can help you delay your aging process.
And I think that's a great way for us to start off by saying there is nothing perfect. We should not strive for that.
Exactly.
I tell people, I said, because I've been in the media, they'll see pictures and they're like, oh, that's the perfect, and I'll just use beer. Mm-hmm. That's the perfect head of beer. And I'm like, okay, that they put dishwashing liquid to get the foam up. And so and they're like, wow. And I said, that's because it looks that way, but it's not that way. We're not perfect. We shouldn't strive to be.
Yes.
We have perfection within us.
Exactly.
And,
yes, you're right.
And we are, and what you do brings out the betterment of it. And I think that's a great way for us to understand and take a look at it, especially being here in the West Indies. Mm-hmm. the number one thing is the sun.
Yeah.
The sun is 365. How can we go out and kind of have that healthy glow without putting problems onto our skincare regime and things of that nature?
So, Chuck, I would like to tell you certain things before I actually get into this. So, this self-care is very personal. Now, you might want to take steps in terms of self-care by using certain products for yourself. Somebody can, drink a lot of water for the skin. And there are some people who want to go to a doctor for enhancing or, just taking care of their skin. Now, in terms of the sun which you are speaking, how much ever you try, there is some sort of sun damage or some kind of tanning which always happens. So everybody prevents that by applying a SPF for them, taking care, not going out in the harsh sun. But there are also many ways you can just get rid of that tan. You can heal your skin because of the sun damage. So there are procedures called as the chemical peels, wherein you can, every now and then get them like every monthly. You can go and then these chemical peels can help you remove the outer dead layer of the skin, which is usually people always get by, exposing themselves to the sun and the sun damage.
Right.
But not only chemical peels, Chuck, there are many other treatment modalities wherein you can use them to just in general take care of your skin, and even for that matter an aging skin, you get as you age you get those fine lines, and sometimes people also get those uneven skin tone, and
exactly. So when you talk about that and you say uneven skin tones, most people see that, but they don't understand what that consists of.
Yeah.
From a doctor's point of view, they say, I have some discoloration here and there. How can I come in and talk to you and get more even skin tone?
Okay.
And deal with there's a term I read, RF microneedling.
Yes.
Tell me a little bit how that plays into it all.
You've come to a very, very special treatment modality. So the RF means radio frequency. And it's a treatment which combines the traditional microneedling with the fractional radio frequency. And I just want to get as you asked me, what exactly is an uneven skin tone. So in terms of uneven skin tone, it can be like if you get tanned, sometimes you must have noticed then like the forehead is tanned, or sometimes you get acne scars, or the melasma or hyperpigmentation. So all these, then your skin tone doesn't look even. And RF microneedling is an amazing way of treating this. Now, in this treatment, what happens is there are very fine needles which are used along with the radio frequency, and they create kind of micro injuries into your skin. And then what happens is your skin heals itself. It's like natural healing by the production of the collagen and elastin.
Right.
And this is the natural healing process of the skin.
Right.
So
so for all my listeners, it forces the skin to heal itself in an even manner.
Yes. So it works at the cellular level, and it's the body's own healing mechanisms. And with the usage of this machine, and let me tell you, I just want to tell the brand, which is an amazing brand. It is Secret RF by Cutera. And with the help of these fine needles, we can deliver the radio frequency at various depths. And this is a controllable depth. So we are not kind of overheating the outer layer of the skin. So there is no damage to the outer part of the skin. But when you deliver the heat to the deeper layers, where exactly the collagen framework is,
right,
then what happens is there the healing takes place, and
it's on for folks, imagine if you're on the surface and you go down about 50 feet. That's the cellular level that we're talking about.
Okay, yeah. So cellular level, you just like, you see the crust of the earth. So that is the outer layer.
Yes.
And it's something which is happening below the crust of the earth, but nothing is happening to the crust.
Right.
So you're not damaging the crust, but then you're working underneath.
Exactly.
So that's how the body works below the surface of the skin.
I think that's great. And we have that, and you have those machines on Island?
Yes, we have them, and the results are amazing, Chuck. And I've done a couple of of people, and they're like amazing and very good results.
Okay, yeah. Excellent. Folks, we're going to take our first break as we continue on talking about realistically all of the things that, and I, ladies, I'm not being rude, but this is the things that ladies really are concerned about, facial TikTok and all of these things that, on the social level. These are things that I say people need to understand and see, especially because when you have young daughters, you really find out about this stuff because they're like, okay, Dad, this. And so they were really excited when I told them that I was talking to you today. So I may have one or two teenage questions that they've hit me with. And we're going to come back to that as we continue talking to the doc about facial aesthetics and a little bit of dentistry. I want to dabble a little bit in that before we.
Okay.
So we're going to take the 2 minutes and come right back. You're listening to BAF, Your Health, Your Wealth. Each and every Wednesday morning, we get together between the hours of 6:30 and 7:30 a.m. And we talk about things that are realistic to you health-wise, things that's happening right here in the CI, and you have the ability to talk about it. And I'm going to bring in Miss Vivian later on. She'll tell you all the details of how you can get in contact with these wonderful doctors that we interview here from time to time. Keep it right here.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, talks about sciatica and back pain.
Millions of people worldwide suffer daily with debilitating back pain, in particular, lower back pain. I know, I'm one of them. Like all pain, back pain is a symptom of a larger medical problem. Your back is a complex system of muscles, ligaments, nerves, and bones. An injury to any of these components can impact your entire back. Back pain can also be a symptom of kidney disease. But for now, let's take a look at sciatica, a common problem that begins in the lower spine and causes major pain and discomfort. Your spine is made up of bones called vertebrae that are separated by flat, round disc housing connective tissue, which sits protected within the vertebrae. However, when the discs become worn because of injury or aging, and the soft connective tissue begins to bulge beyond the disc, then you have what is called a herniated disc. Herniated disc can cause severe back pain because it puts pressure on surrounding nerves, including your sciatic nerve. The longest nerve in your body, your sciatic nerve, starts in your lower back, then splits to run through your hips, your buttocks, legs, and feet on both sides of your body. This explains why sciatica can cause severe radiating pain down your legs, as well as numbness, tingling, weakness. Anything that puts extra pressure on your spine can put you at a greater risk for sciatica. This includes being overweight, frequent heavy lifting, sitting for too long, whether for work or leisure, and as mentioned before, damaged discs. For many people, over-the-counter painkillers and anti-inflammatories like ibuprofen or naproxen, lidocaine pain patches, or alternating hot and cold packs on your back for a few days will help relieve pain in the short term. But if these do not work, then you may want to discuss a long-term solution with your doctor. Alternative medical interventions, such as provided by a licensed chiropractor, acupuncturist, or massage therapist, may be able to provide significant long-term relief, and a physical therapist can teach you stretching exercises that release the pressure on your nerves. But for some people, surgery is needed. Only you and your medical practitioner can make that decision. Back pain can stop you in your tracks, but with medical help and a commitment to finding the right solution that works for you, you don't have to stop living.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
I'm free to live my life, yeah. Free to be me, yeah. The way I wanna be. Doing the things that I wanna do. Hey, I'm living my life, hey. BAF for life. Yes, I'm living my life, hey. BAF for life. For life. BAF has got you covered.
Welcome back to Your Health, Your Wealth. Today we're talking all about facial aesthetics and what it really underlying is, because we see that we have become a culture that relies heavily on there used to be beauty treatments, but now I think we've moved past beauty treatments and start looking at the molecular structure of things and the understanding of things. And I have with me here a wonderful doctor who has been in this industry for many moons. I won't say a lot of time, but many moons. So she understands what it takes from teenagers to adults when it comes to aesthetics. Doc, go ahead and introduce yourself to our public again, please.
Hi, everybody. Whoever is listening to me, this is Dr. Shalini, and I am here at Aesthetica Total Health.
Excellent. And I wanted to start by kind of talking about skin boosters and things because most people don't realize that your skin is with you for life, you know?
Yes.
So the earlier you get into good practices and understanding it, the better it will treat you in the long run.
Yes.
So this is kind of from my teenage, well, she's 17, 18-year-old, but she actually, said, Dad, ask her about skin boosters and what that is and how they can kind of work to betterment your skin over time. So I'll throw that question at you and you can go ahead and answer. And this is for teens. And teens, once again, if you're listening to us, and please talk to your parents about, going to see a doctor or anything like that before you start any sort of regime or you think that you can do it yourself. Please, please, please seek the help from a professional and always talk to your mom and dad about it. So with that being said, go ahead, Doc.
Yeah, Chuck. So, most of us, we have teenagers in our home, and even me, I've been dealing with this acne problems, which happen because of their, these hormonal changes which happen in the teens. So for these kind of problems, we have very mild chemical peels which can help reduce the oiliness, because the acne, the basic cause of acne is the oily skin. So anybody or any like the teenagers, they can always come along with their parents, and we can just generally assess their skin, see their skin type, and recommend some basic procedures like a mild chemical peel which can help reduce the oiliness of the skin and help fight the acne. Of course, there are other treatment procedures also along with the peel. So I'm just sticking to ones which, I will be performing. And the skin boosters, Chuck, these are the amazing preventive treatment modalities in the aesthetic industry, because these are, I would rather say in a layman term, are injectable moisturizers.
Okay.
And there are a variety of the boosters. Some are pure hyaluronic acid based. Now, hyaluronic acid is a natural, product which is naturally produced in our skin.
Okay.
So by injecting them in the superficial layer of the skin, we kind of give a boost to the skin, and your skin becomes a little plump and more hydrated.
That kind of like an energetic boost
Yes.
to help it glow to the fullest and move forward and maintain that.
Exactly. Just like, you just wash your face and you feel that tightness until you apply a moisturizer. So now imagine the moisturizer going in, injecting, like it's not these are like very teeny tiny injections, which are, we just given this very, very superficial layer, but then your skin is totally, absolutely hydrated and moisturized.
Right.
Again, in the boosters, you have different combos, and which suit different kind of skins and the different kind of skin types.
Okay, so you're able, of course, with the initial assessment, as they say, no two is ever alike. So so you kind of find the best balance for each and every skin type and person
and the age of the person. Okay. So maybe you come to me and I will probably recommend you a hyaluronic skin booster. For somebody else who has some fine lines or the laxity, I might give a combination of hyaluronic acid plus a complex of amino acids. Then the recent addition are also polynucleotides skin boosters in the industry, and they are derived from the salmon DNA. I don't want to get into these scientific details, but yes,
Doc, I will tell you, kind of prepping for this, it's amazing. Dr. Google on the internet, you can type it. A lot of Hollywood actors and actresses go through a very regimented thing that you're talking about.
Yes.
And you kind of think, they wake up in the morning, they splash water on their face, but they spend a lot of time dealing with the science behind it to get the best look for, whatever movie it is or whatever there is. I actually, folks, in a little sidebar, I saw a recent movie, I won't call the name of it, but they actually had a skincare specialist on the team of directors to tell them how they should. And I'm like, wow, I would never have thought that. But that is where we're at with understanding skin and cellular momentum with it.
Yeah, exactly. Haven't you heard about Kim Kardashian vampire facial? So that is, now if I talk about the holistic side of that, that facial is actually using your own blood. You know that? So it is called the PRP facials. And what is PRP? Now, PRP is a kind of autologous biological entity wherein we draw the blood from a person, we centrifuge it, and we get a PRP which is highly concentrated, approximately like 5 to 8 times of the platelets. Now, platelets are the a component of blood which is helpful in the healing and the clotting. Right. So, not getting again into the scientific details, but then the PRP. So, when injected, and coming to the cosmetics here, when we give you injections of PRP, it promotes the healing, and again, it also stimulates the production of the collagen and elastin. And the results are almost like, it helps in reduction of your fine lines, wrinkles, all those laxity. So PRP is also an amazing thing which you can, make a practice of getting it done for your own self-care. And it's a very natural thing.
So we've been talking about a lot of stuff that people haven't probably heard before, because unless you are on, I would say, a lady who, or a more adult female who has been in that and done the background, they haven't heard of this. Let me ask you about a terminology that has become very, very day-to-day. Botox.
Yes. Okay.
Most people 7, 8, 10 years ago did not know what Botox was, and that was kind of the go-to. And then all of a sudden, everyone, they had a huge campaign in the US, and the world knew about Botox. Tell me a little bit about Botox today.
Oh, so Chuck, I assume that most of the ladies who are listening today in the morning, they must be knowing about Botox, because this has been in the market since ages now. But just for the people who don't know about it, so Botox is actually a brand name of a neurotoxin. Okay. So these are there are different brands, and Botox is one of them. So these neurotoxins, what they help do is they kind of paralyze your muscle. So, for example, have you seen people have those frown lines between their brows? They have those 11s.
Never disappear.
They never, and you're furious. You overuse your muscles. So when you overuse your muscles, you get those lines on those horizontal lines on the forehead. You also have sometimes the crow's feet around your eyes,
on the bottom of the eyelid.
Exactly, yes, those ones. And sometimes even you have with age you can also get a downturned smile, and even something like the people, have you heard about people getting pain in the TMJ, or rather the joint of the jaw joints,
right? Your jaw joints, which is your jawline between your ear and
yes. So that's because of the hyperactive, some muscles. So cosmetically, we can use botox to actually paralyze those muscles which are creating those lines or those wrinkles. So you can use it for removing the lines on your forehead, on your around your eyes, for the crow's feet, and even you sometimes people have gummy smiles. We can use botox for treating them. Then you have sometimes those dilated nose. And even for that matter, for a lip flip. Now, lip flip is a very interchangeable thing, because people usually go for fillers to plump up the lips. But then somebody who doesn't want to enter the arena of the fillers can actually use botox to just, a little bit kind of give it a little kind of a lift to the lip.
Cayman's community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
Welcome back to Your Health, Your Wealth, brought to you by BAF Insurance. Before the break, we were just talking to the doctor about Botox. Let's continue, Doc.
So Botox, yes. And not even Botox, but apart from Botox, you also have Dysport. We have Dysport. So these are different brands of the neurotoxins, and it depends on whoever wants what kind of things. We can always talk.
I think one of the things that people need to understand is that you really need to have a regime. You almost need, like how I said, you need to have a game plan of how to go about this.
Yes.
Because you don't want to overdo one area and underdo another one.
Yes.
So that's the best thing, I think, when you talk about service of cosmetic dentistry and things of that nature. You have to talk to a professional.
Yeah.
You have to sit down, and because most of this stuff isn't going to happen overnight.
Yeah.
People think, that they walk in and they walk out and everything is just the way how they want.
No, it doesn't happen.
It takes time and takes you sitting down and developing a really honest honest skincare regimen moving forward. Let me talk to you a little bit about dermal fillers.
Yeah.
We brought up the word fillers, and most people kind of get shy with that word.
Yeah.
Dermal fillers, tell us what that is and how it can be helpful.
So dermal fillers, as the name suggests, Chuck, fillers are something which are used to increase the volume. Okay. So as we age, we have different various fat pads on our face. So as we age, they migrate, and you start, your skin sags. There is loss of laxity in the skin. So fillers are used to give you volume. For example, there's loss of volume in your cheeks or somebody wants to enhance the jawline. So fillers are used to give volume to certain areas wherever it is needed.
Okay.
Yeah. So and they've been people been talking about those pillow faces wherein you overuse the dermal fillers, but then now everybody is towards the natural thing. So now is the time of doing things in a very subtle manner.
Right.
So we don't have to overdo the fillers to make your face like a pillow face, but then we have to do it very subtly and very aesthetically to enhance the beautiful features.
I think that is this is one of those times where less is more.
Oh yes, less is more, and good things take time.
Yes, exactly. And I think that's the thing that a lot of people, as we get older, we want to look and kind of pause the aging process. Now we can't stop it, but we can slow it down, and we can kind of put back what nature is taking away in some degree.
Yes.
And so with that being said, folks, we're going to take our next break. We're going to come back, and I'm going to talk to the doc about exome therapy. Am I saying that right? Exosome therapy. And this is really going to be pretty in-depth because I want to ask her, well, you know what? We're going to come right back and we'll do that. Keep right here. You're listening to BAF, Your Health, Your Wealth. Each and every Wednesday morning between the hours of 6:30 and 7:30, we get together and talk about all things related to your health. And this time we are talking about skincare, all the facial aesthetics that we have. And I'm going to try to bring Miss Vivian into the conversation too on how you can get access to all of these wonderful services that they have over there at Total Health. Keep it right here.
Hi, I'm Anne, supervisor at BAF Insurance, and I'm inviting you to take a look at BAF. For the past 12 years, I've had the pleasure of helping our members receive the best healthcare, working for a company that offers the best in affordable, quality health plans. At BAF, we work overtime to ensure our members receive the best service available, and we boast an enviable track record in settling claims quickly. It's the BAF way. So if you have already looked, it's time to take a second look at BAF. Visit our website at bafcayman.com or give us a call at 949-5089. Our professional and knowledgeable staff are waiting to help you find the right plan to fit your needs.
If you want coverage for life, choose BAF, they'll get it right.
Today on Be Well, Be Healthy for Life, Lady K, your wellness coach, tells us about mosquito-borne diseases.
Mosquito bites can range from annoying and itchy to deadly. And the only way to be safe is to avoid a bite altogether. Today, we look at some of the common mosquito-borne diseases and how to prevent them. Remember to like and share this video with a friend or relative. And while you're here, go ahead and click the subscribe button. Now, in the last decade, we've seen diseases such as dengue, Zika, or chikungunya sweeping through our population, with patients exhibiting symptoms such as fever, headaches, muscle pain, joint pain, and a rash. These ailments were all spread by the Aedes aegypti mosquito, which can be easily recognized by black and white markings on its legs. It's also called the yellow fever mosquito because it can spread yellow fever as well. But why do they bite? Well, the females require the proteins obtained from the blood of humans and other animals in order to mature their eggs, and that's why they come in for a tasty meal from us. Mosquitoes are vectors, so they get the virus from an infected person, animal, or other mosquito and then pass it on to us. Not all mosquitoes carry the pathogen that spread the diseases we mentioned before, but there's no way to readily tell which ones are infected, so it's best to protect yourself around the clock. Here are a few tips to help you prevent mosquito bites. Erect mosquito screens on your windows and doors, or if you already have them up, check them regularly for any breaks or damage and quickly repair them. Use insect repellent containing DEET whenever you're outdoors. Wear long sleeve clothing. Remove standing water and other mosquito breeding sites from around the areas in your home. Mosquitoes breed in stagnant water found in places like your drums, plastic containers, tires, flower pots, and old bottles and pans inside and around the yard. Get rid of those immediately. If you're planning a trip abroad, do a quick search to find out if there are any outbreak of mosquito-borne diseases so you can protect yourself accordingly. And if you have symptoms including fever, headache, muscle, and joint pain, see your healthcare provider as soon as possible. Now, there's a common misconception that a person can catch diseases like dengue and chikungunya only once. That's not true, as these illnesses have several strains. So, whether or not you've had it before, take the necessary precautions. Some people also believe that mosquitoes prefer certain blood types or only bite at certain times of day. There is no current scientific proof that either of these statements are true. While some species are more active at dusk and dawn, you can get bitten at any time of day. Remember, suit up, by wearing the appropriate clothing outdoors. Spray up with repellent containing DEET and be sure to contact your doctor immediately if you feel you've been infected with a mosquito-borne disease.
Be Well, Be Healthy for Life is brought to you by BAF Global Group. Remember, always consult your doctor before starting any new health and wellness regimen. BAF Global Group offers life, health, and general insurance plus a full suite of financial solutions in the Bahamas, life insurance in the Turks and Caicos Islands, and affordable individual and group health insurance in the Cayman Islands. Visit us at mybafsolutions.com.
I'm free to live my life, yeah. Free to be me, yeah. The way I wanna be. Doing the things that I wanna do. Hey, I'm living my life, hey. BAF for life. Yes, I'm living my life, hey. BAF for life. For life, BAF has got you covered.
Welcome back to Your Health, Your Wealth, compliments with our friends over there at BAF. We're talking to our friends over there from Total Health, and I wanted to bring in a little bit more information about the services over there at Total Health. Hello, Miss Vivian. How are you?
Hi, Chuck. How are you? I'm very happy and very glad to be here with you and all your beautiful audience.
Thank you. Thank you so much. So, you guys over there at Total Health always bringing the best to the island, always moving forward, thinking not to be funny, but aesthetically, which I want to say, kudos to you and the team. What else do you have, guys, over there?
Well, we have grown so much in the past 3 years. And yes, we have all the preventive that we've talked before. We have the dental department. We have pediatricians. We have an OBG. We have the ophthalmology department, our internal, the internist physician. And now we just welcome Dr. Shalini for our Aesthetica by Total Health. Okay. And she got wonderful, services to provide to all the ladies, specifically the ladies on the Cayman Islands. But we also have some, she will speak further about this. A PRP also is covered by insurance for certain medical conditions. So it's, out there for the people to know.
Exactly. And, So if someone's listening here and they have some questions or they want to book an appointment, how can they go about and do that?
Absolutely. They can call the number for Aesthetica specifically is 345-326-2336, or they can call Total Health 333-2222. The website's the same. It will be totalhealth.ky/Aesthetica, and it'll just a landing page there.
Right.
Easy to book.
Two or three clicks and you can book an appointment.
You can book an appointment and read all about it too.
Exactly. And I've been to the website, and you guys provide some great information. Yes. And I think that's kind of the way that I'm glad that Cayman is going, that there are choices, that there's ability to get some more information. You don't have to fly off island, spend 2 or 3 days doing stuff, and you can do it right here. You have the ability to get the information and get the services right here on island.
Absolutely. And with the best, we have a great team and also amazing tools, put it that way, like our it's a state of the art what we have in Total Health. So
exactly,
check it out.
Where are you guys located at?
We are at the Grand Pavilion. The Grand Pavilion, West Bay Road.
Excellent. You can't miss them, folks, when you're heading down there. All of my older Caymanians will know that was originally one of the big hotels here on island, and they converted it, and you guys have a huge portion of it. I went down there just a few days ago, so kudos to you and the teams.
Thank you.
Definitely. Let me switch over to the doc and bring you into the conversation. I was asking a little bit about eczema therapy.
Yeah, exosomes.
Exosome therapy, yes. Right. And these are probably terms people without skin conditions haven't heard before. So explain to them what that is and how the therapy works into it.
Okay. So Chuck, as we are advancing, there are a lot of research happening around exosomes of lately, and these exosomes basically they are these are nanoparticles, which is a part of the extracellular matrix. Again, I don't want to use the scientific terms, but these nanoparticles, they have certain proteins, certain lipids, which can, kind of reset or repair your skin. And this can be used in combination with the microneedling, that is the radio frequency microneedling. And you can, after we create these micro channels in the skin, exosomes can be applied, and it's very easier for them to penetrate inside deep into your skin after a microneedling procedure.
Okay.
And not only exosomes, we also have treatments which have growth factors and all those brightening solutions which can be clubbed along with the microneedling procedure.
Okay.
Yeah.
And I think that people need to understand that when you're talking like this is really, people say, oh, I have a skincare regimen. I get over the counter. This is really down to the structural level of the skin base. We're talking really the DNA of your skin,
yes.
how to manipulate that to get the best out of it, how to use certain, and I want to say technology in the area of building back that healthy glow that you had when you were, whatever age it was.
Yeah.
There are ways to go about that isn't over the counter. Yes. And so, folks, please really understand that what we're talking about here is really to structure the skin cellular level that we're bringing to you. So let me ask you this. I saw this and I wanted to say, because me, I'm follically challenged, and I
yet you are very handsome, Chuck.
Yeah, thank you, I appreciate that. I always find it interesting when I talk to people about hair restoration.
Yeah.
You guys do something like that over there also?
Yes, and again in a very natural way by using the PRP.
Okay.
I again get back to PRP, which I told earlier. It's your own blood, which has a lot of growth factors, and when we use that blood in a concentrated way by making it a PRP, and then we can inject into your scalp, and it can help in the hair restoration and regrowth of the hair too.
Right. So people whose hair are thinning out, you can help regain the basis of that allows it to grow.
Of course we can, but then again it depends on the type of hair loss. So we have to analyze before and always do it where we can achieve the best results.
I think that's exciting when you think of how far science has come. And I remember the old TV shows, the Hair Club for Men, and you think about, you laugh about that, but then you think that this is really dealing with the problem at the core.
At the core, and very early in life. So skincare is about, you have to start early in life because it goes a long way. And trust me, I have seen there are people who take so good care of themselves. So even if they're in their 50s and you can't make out because they've been practicing some good skin care regime and, their regular visits. So, and they very nicely delay the process of aging.
Right.
Yeah. So
exactly. I think people need to understand, that when we talk about these things, this is achievable on island. And I think that is one of the things I want to hammer home, that once you talk to a professional like yourself and you understand what it is that they're trying to achieve, you will figure out the best way of achieving it and getting close to that. Because, sometimes I want to grow full hair. I want dreadlocks again, but realistic conversations. Yeah. And I think that is a great way to do that. You have the highest standards in skincare and innovations in aesthetic. I wanted to, before we get to wrap up, I wanted to say, about the cosmetic dentistry part of it.
Yeah.
I touched on that a little bit. People think of veneers as cosmetic dentistry, but it goes deeper than that.
Cosmetic dentistry is vast, Chuck. It is not only veneers, it is also, brightening your smile, your whitening your teeth, or aligning your teeth with the use of invisible braces, like we call them aligners or dental aligners. So cosmetic is how you want to look as per your, in terms of your teeth. So it can be either whitening or aligning or even giving you a new look to your face, like a smile makeover. So there are different arenas of that.
Okay.
So and I can go like hours for speaking about each of that. So let's not get into that.
And see, I think that's just it. When I always laugh and say when someone is knowledgeable and passionate about something, it comes across very easily. And I can see that with you. So folks, if you've heard anything that we've talked about or it sparked an interest and you want to see something as whitening your teeth to having a full structural look at it. Once again, Ms. Vivian, say if they want to reach out to you, how can they do that?
They can call us at the 345-326-2336. That's the easiest way to contact us and book an appointment and come see Dr. Shalini.
Exactly.
Yes.
Folks, we're going to take our final break and come back. We're going to wrap up. I think this is a really fascinating new arena for us with Aesthetica right here at Total Health. We'll be right back.
This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
Your health, your wealth, your health, your wealth, your health for life.
Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
I'm free to live my life, yeah. Free to be me, yeah. The way I want to be. Doing the things that I want to do. Hey, I'm living my life, hey. BAF for life. Yes, I'm living my life, hey. BAF for life. For life. BAF has got you covered.
Welcome back to Your Health, Your Wealth. I'm your host, Chuck Taylor. Each and every Wednesday morning at 6:30 a.m., we get together bright and early all the way until 7 and talk about all things related to your health. And today we have the good folks over from Total Health with the innovations and the highest standards of care over with Aesthetica. And Doc, I'm going to give you time to wrap up, but I just wanted to say before we do that I think the services that you offer along with the technical side of it has probably blown people's mind away of the things that they can achieve visually, aesthetically, and also on, I want to say, the DNA level of their own body.
Yeah, you're right, Chuck. And I would say that these days what we have is the tech-enhanced aesthetics. So, and people are also concentrating on the holistic approaches now. So because Botox and fillers have been there since years now. But these days what is happening is we are using, for example, a PRP, wherein it's your own blood, or a booster. All these work in a very natural, subtle way at the cellular level. And even for that matter, a radio frequency microneedling. So it is just promoting the healing inside.
Right.
So there is nothing foreign, but then everything is done in a very holistic and in a very natural way to enhance the looks of a person.
I think that is so important that what you just said, that people understand that your own body is healing to give you a better outcome, a better movement forward. You know, you're not putting foreign items, you know, and it's just, as you said, very holistic for the body.
Yes.
Exactly. So before we get out of here, I'll just toss it on to Ms. Vivian just to wrap up. For anyone who's been listening who wants to get in contact and book an appointment,
absolutely, they can visit our website, and it's Total Health, the KY/Aesthetica, or they can call directly to the phone number is 1-345-326-2336. They can book an appointment and come for a consultation.
Excellent. Ladies, thank you so much for stopping by here this morning.
Thank you, Chuck. Thank you for having us here. Thank you so much.
It's always lovely to see Chuck.
Yeah.
I appreciate that. Folks, keep right here. Make sure you reach out to these wonderful folks over there at Total Health if you need their services. We'll be back next week. I'm going to tune in same time, and I would say same bat channel, but I'm not Batman. Keep it right here.